I hit it.
Okay. So what college did you attend for your undergraduate?
Undergraduate,
Mm-hmm.
school called Davis and Elkins College,
And where is that?
West
located?
Virginia.
Oh, okay. So are you from?
And then I got a master's at West Virginia University,
Okay.
and then I got the PT at UCA.
Okay. So was physical therapy always your first major when you went into school?
No,
No.
sports medicine. That's my
Sports
thing.
medicine. So if it wasn't physical therapy, like what made you go into physical therapy from sports medicine?
With sports medicine, you're working with athletes and you're doing rehab, and I like the rehab component, so I stuck with the rehab and decided to do physical therapy.
Okay. So what was your first job out of college? Straight out of college?
High school, athletic trainer,
Mm-hmm.
and teacher.
Did you enjoy working with the high school?
Oh, yes.
Yeah. So how long have you been working in this profession?
In this profession, almost 20 years.
20 years?
Yeah.
Okay. So I was aware that you worked with the sports team
Mhm.
before, so can you just describe like how your experience was and what you did with the sports team?
The sports teams, I worked as an athletic trainer for high school, did that for a year.
Mm-hmm.
Then I worked at a University of Charleston, West Virginia for 3 years. Then I came here to Arkansas and I worked in a clinical base as an athletic trainer, doing an outreach program to the area high schools in Little Rock. And I decided then that I wanted to do more clinical than physical therapy.
Mm-hmm.
So I went back to school and did PT.
So can you just describe like what you do now with the clinic here?
Here I'm the clinic manager and I'm a physical therapist. We treat outpatient, mainly orthopedics, musculoskeletal, patients from pre-op, post-op, just conditioning, strains. So, you want patient population, what do you?
Just like what age of people do you see
Oh,
here?
okay. Age of
normally?
people were probably from probably teenagers to elderly, geriatrics.
Okay. So like what advice would you give someone that was trying to pursue a career in physical therapy?
Keep your grades up.
Would you say that it's a hard one to maintain?
It's not hard to maintain. If this is what you want, or PT, OT, any of the rehab disciplines, even speech, or just keep your grades up and go ahead and maybe volunteer somewhere to get the experience to see if that's truly what you want to apply your higher education to. And, during the summer, when you're out of school, come in to an area clinic or even a hospital. Because physical therapy varies from setting to setting.
So you would say that it's important to shadow and intern?
Shadow, intern, or even some places even hire in the summer and can do physical therapy aid. And they can help out. If you go into the hospital, you see a lot different cases, patient population. You'll see the stroke, you'll see the head injury, you'll see the spinal cord injury. You may see amputees and things of that nature. So you get to see different disciplines of therapy. You probably see more disciplines of therapy, OT, PT, speech, everything in a hospital base. It's usually a good place to start to see if that's something that you want. Outpatient is just more specialized and more streamlined to probably higher level patients per se, post-op and shoulders, ankles.
So have you ever worked with kids before?
Yes.
Because that's like what I'm wondering.
You want to do pediatrics?
With kids.
I've done very little with pediatrics. Again, as you go through school, you're going to touch all bases. You're going to touch pediatrics, you're going to touch adults and geriatrics. You're going to do all different disciplines of therapy. But then when you get out, you specialize usually in the setting. And peds is a specialized area. If that's something that you're interested in, then go down the street to the see if you can shadow something over there, because they'll deal with the kids who have Down syndrome and autistic and developmentally, delayed. So that would be really good.
Okay, so
So
just
you
to,
want peds.
yeah.
Fun.
I know. But, just to, wrap it up, so, would you say that you really enjoy your job and what you do for free?
And would I do it for free? There's no way I can do it for free, because I gotta pay my debt off, you know. But I would do it. You'd be surprised. Yes, I love my job. I love it. I love what I do. You know, free is hard work.
Yeah, it is.
I don't know if I would say it for free.
What you do.
Sometimes I'll give my free time out, and I might do a little extra with a patient that just needs it. But, for the most part.
Yeah.
Now I gotta make a living.
Yeah, well,
I gotta pay my bills too.
yeah. Thank you so much for me.
That's it?
Yep.
Okay, that was easy.